Please, doc, what can I do? My mom called me 45 times yesterday. Now, unfortunately, this is not an uncommon problem. I have had multiple patients in similar situations where they're calling the family like 40, 50 times a day, or some of them, for example, calling 911 like several times a day, asking for the police or the fire department to come and save them because either they've been kidnapped or because they cannot find their shoes. I mean, so many reasons why there's problems with the use of the telephone. My name is Dr. Miguel Rivera, and my friends call me Dr. G, and I am an adult psychiatrist with a practice dedicated to those with Alzheimer's disease and related dementias. So as I always say, just remember to not take things personally. Your loved one with dementia most likely has short-term memory problems and they just don't remember that they called you 5 minutes ago. Maybe they also have problems with their ability to reason and to make sense of things. Or they may have problems dealing with the changes or stress in their lives in this particular moment. Just think of it that sometimes that little telephone can be like your loved one's safety blanket. Now, with that in mind, what are some things that we can do? Number one is make sure that there is nothing physical going on. Make sure, for example, that there are no pain issues involved. Now, I had a patient that was making multiple phone calls to the family, mostly just asking for nonsensical things, calling, hanging up, and we actually discovered that they were having some peripheral neuropathy pains. So they were having burning in their feet, but they were not able to really express this to the family. Once we got their pain controlled, then the phone calls ceased. Things like, for example, urinary tract infections can be another reason why people can experience behavioral changes. Another one of my patients that was making multiple phone calls to family ended up with a urinary tract infection. We got the urinary tract infection treated and the person got better. Number two, are they having any mental or psychological issues such as depression or anxiety? In more than one occasion, I have dealt with these multiple phone calls by addressing some sort of mental distress. Many times with a small either supplement or intervention for depression, the phone calls can diminish. Also by addressing anxiety problems that, hey, sometimes they come in the afternoons, what we call sundowning. For example, this patient that was calling the family multiple times a day began doing so after lunch. So it was a pretty clear case of sundowning. So what did we do for it? Number one, I just adjusted the time of her medications and then we engaged the facility. We let the activities department know that we were having some problems with the patient returning to the room after lunch and then beginning to make phone calls to the family. So the activities department actually created an activity just for this person. And that made such a difference. A little bit of medicine and the cooperation with the facility staff were able to kind of help the person be redirected and stop making these phone calls. And this brings me to the issue of boredom and isolation. And this is where talking to the facility and to encourage activities and socialization can be so important. I mean, think about it. If you are by yourself in a room, what are you gonna do? The first thing you're gonna do is grab your phone, start surfing around, calling people, trying to bring in some sort of connection, some sort of excitement into your day. So to recognize that these are real issues in facilities, the boredom and the isolation, particularly in the setting of COVID. And I want to really just give my kudos to the facility staff from all these places where I visit, where I know that they have been trying to do the very best that they can for their residents under these really difficult and problematic situations. I mean, even a younger person that gets put in solitary confinement will develop mental problems and will have major psychiatric difficulties. Now imagine isolating somebody who already has cognitive problems, who already has dementia, and all of a sudden they have to be isolated in their room. Now in these cases, what I have done many times is use either a supplement or a medicine that can help with agitation, that can help with mood. Even though this is not the go-to thing. The go-to thing is let's increase socialization, let's bring in some music, let's bring in some massage, let's anticipate the periods of when these phone calls do tend to happen. That would be number one. But in the setting of not being able to do that, in the setting of having your loved one being isolated in the room, hey, sometimes a medicine or a supplement can be a great thing. One of my family caregivers shared with me that one of her great realizations was that she did not have to pick up the phone every time her mom called. She actually created a schedule where she was calling every day around 10 o'clock in the morning and around 4 o'clock in the afternoon. And she made a little sign and put it by the telephone at her mom's room that said, "Mom, I will call every day at 10 and 4, otherwise I am not available because I am at work." It worked like a charm. She further shared with me that to create this schedule, and together with the realization that it was okay to not pick up the phone every time, kind of set her at ease. And it helped her deal with some guilt and kind of shame feelings that she was having. Once she also realized that, if there is a problem, the facility is going to let me know. That was like so huge because she realized that whenever her mom called, most of the time it was for fairly inconsequential stuff. So to have a plan when you're going to call, to let your loved one know in advance, and to feel okay with not having to pick up the phone every time is definitely beneficial. Another thing that you can do is to have the staff keep the phone. That way, if your loved one needs to make a phone call, they can always ask the nurse or reach out to a staff member, "Hey, I would like to call my daughter." So the staff can actually run some interference and make sure that the phone call is indeed appropriate. This has been so helpful and so beneficial in many of my families to, instead of taking the phone away, which may eventually happen, but a good halfway step is to have the staff keep the phone and to give it to the patient only when they feel that the phone call is appropriate. And then understand that as the disease progresses, at some point you may have to take the phone away. I recommend to most of my families that have a loved one in a memory unit to not give them a phone. It can actually be a significant source of distress, both for the patient, for the person with dementia, and also for the family members. So it is important to be flexible and to be open-minded and to keep the well-being of not just the person with dementia, but also your own well-being in mind. I hope you found this useful, and I will see you on the next video.